everybody. I'm Jessica. I'm an RVT here at Holistic Veterinary Care in Oakland, California. And today we're going to talk about veterinary physical rehabilitation. Come on in.
This is Dr. Gary Richter, owner and founder of Holistic Veterinary Care. Before we deep dive into what is physical rehabilitation of animals, do you want to tell us a little bit about your practice and what you do here?
Sure, I'd love to. So this is Holistic Veterinary Care. What we offer here is really an integrative approach to medicine. So both Western medicine that we all know about, surgery, pharmaceuticals, what have you, but also complementary and alternative care, acupuncture, chiropractic, herbal therapy, hyperbaric oxygen, ozone, and of course, physical rehabilitation. So really, the way that all started for me is I had been in Western practice for a long time, and it just started to really become clear to me about what the limitations were. That there was a certain level to which I could get my patients better, after which there was just nothing left to do. And I never really liked having to go to people and tell them that there was nothing else I could do. And that really led me to start looking for other things. It led me to look at acupuncture and chiropractic and herbal therapy, etc. And that's really how Holistic Veterinary Care was born. And what I have found over all these years is that when you take an integrative approach, when you use Western medicine and alternative medicine, you frequently get far better outcomes than you would with either one of them alone. And that's certainly true when it comes to physical rehabilitation.
What a cool origin story, right? So great to hear about this practice and how it got started. And I'm excited to deep dive into some of these types of care. So let's start with the definition of physical rehabilitation. Now, physical therapy is a protected term in the human medical field. And so we have to be very careful that we use veterinary physical rehabilitation as our terminology, right? So really important. So that can be defined as the use of non-invasive techniques to return an animal to functional activity after an injury, surgery, or degenerative processes, right? So we may do orthopedic surgery to repair an injury or, a genetic disorder or something that an animal's born with to try to repair their bodies. We may also have scenarios where as animals age, their body starts to break down and kind of degenerate, so things don't function as well as they used to. And traditionally you just say, my dog is kind of slowing down and they're getting old and that's just that. But now we know we can intervene and kind of help them to return to their normal state of function. And a lot of times we can greatly improve quality of life for these animals as they age. And so we have faster recovery times after surgery, get them up on their feet running pretty quickly. So this area of our field is relatively new. It is also for the human world. So human physical therapy was introduced around the time of World War I, helping soldiers kind of get back on their feet and return to duty, and started to be looked at in horses in the veterinary world in the 1960s. And it wasn't until the 1980s, which may predate some of you, but for me, I was around for that. But basically, it was introduced to help racing greyhounds and try to get them back to normal functional state. And so we haven't really started seeing it introduced with companion animals. So that would be pets that are owned by people, roughly until the last 20 years or so. And so it's really a new thing, which is exciting. We're finding ways that this can be applicable and accessible to people every single day. And I'm excited for us to kind of dig into this. And so it includes the application of heat and cold, ultrasound therapy, electrical stimulation, low-level lasers, use of stretching, massage, therapeutic exercises, and aquatic therapy, which we're going to go over all today. You're going to get to see a little bit of everything. Chiropractic care and acupuncture are considered separate from rehab, but are often used in conjunction for optimal healing and pain management, which is a huge part of why we do this as well. So by applying all of these techniques, what are we trying to achieve, right? Let's ask Dr. Gary. So starting with the process of the exam all the way through kind of setting up treatment, can you explain to us how that all works?
Sure. So with physical rehabilitation, like any other medical procedure, everything really starts with getting a good thorough history and doing a really thorough physical exam. Now, a physical exam from a rehabilitation perspective is a little bit different than sort of a normal physical exam that you would see, in so much as that we're very specifically looking at the orthopedic and the neurologic status of the animal. So we're doing a neuro exam. We're checking their range of motion. We're taking measurements of their muscle mass. So in other words, we're measuring the circumference of their quadriceps and of their upper arms. And the reason why we're doing this is because it provides us with objective data, so that as the rehab goes on, we can find out, is our patient gaining muscle mass? Do they have less asymmetry from one leg to the next? Because obviously when we're dealing with nonverbal patients, we really have to rely on not only our observational data as veterinarians and veterinary technicians, but also any objective data that we can come up with as well. So really that's the foundation. And then we move into the actual physical rehabilitation, which can look like many things depending on what the particular issue is with that animal, whether it's a front leg, a back leg, it's neurologic, it's post-surgical, it's arthritic. There are many different facets of physical rehabilitation, but the end result is ultimately we are looking for better function, less pain, more mobility, generally speaking, happier animal. And that's something that we will reassess not only every time that they come in, but we also schedule regular follow-ups with the veterinarian to kind of retake those measurements and redo those exams to really objectively determine whether or not we're making the kind of progress that we need to make.
Okay, let's visit the team and see some of the ways they help animals recover. Wow, so intentional land exercises, how cool are those, right? It may at first glance look like playtime, but there's actually a ton of thought and consideration that goes into prepping for that kind of care. Everything from the floor type. You may have noticed that the floor in our gym is a black, spongy, kind of grippy substrate. And so we have to take great care to provide maximum traction for these patients. We clip the fur on their feet, keep their toenails nice and trim short, because as you're getting your footing back, whether you've had surgery or an injury or are just plain getting older, we got to make sure that the traction is there so that you don't incur any further injuries from maybe slips and falls. Right? So we also work with different equipment to lead the animals around, right? We use harnesses to help control their body and support them, especially in the case where some of these animals are really weak and maybe prone to slips or not able to hold themselves up, just to really give them the ultimate support without injuring their neck. Takes a lot of behavior understanding, right? So being able to read a dog, knowing what their cues are, knowing if they're timid or afraid, need extra coaxing. Those can also be really big indicators to us that the exercise is maybe too much for them, right? So this is about finding that edge and helping push them through that without overdoing it, right? So you don't want to underdo it and not achieve your goal, but we also don't want to overdo it. So being able to read behavior, many of you have probably spent some time in clinics or animal handling at this point, and have seen what it's like to work with an animal for normal restraint for medical procedures. This is quite a bit different. And so here, we are working with animals, trying to make it really fun and interactive. And so restraint at that point is going to be kind of counterproductive a lot of times. And so most of the time, we're reading them and being able to kind of work with their bodies and flow with them, behavior, energy, kind of their physical ability and stuff like that. We also have to have a really good understanding of their musculoskeletal system and what areas we're trying to address, right? As we come up with these exercises for them and are trying to reach goals to either rebuild muscle or regain range of motion, we have to understand how those parts all fit together in the body. And so a good, strong understanding of anatomy and physiology is really important for doing land exercises with patients. We also have to understand what posture and movement is needed to achieve the activity that we're asking them to do, right? If we're having them step up onto things or sit and stand or perform certain stretches for treats, we've got to understand, are they able to even maneuver that way, or can they handle that level of activity? And then we're also watching for changes, right? Improvement or maybe decline. We're watching for fatigue, right? To gauge their level of response to the exercises. And so all of that is something that we watch out for with doing land exercises. So we always in general start slow, build them up to exercises just like a person might with a normal workout routine. We keep it super positive and fun. Tons of treats here. We use lots of lamb lungs and peanut butter and cheese whiz, treats that owners bring from home. And then we also help owners set up a home schedule for activities to do at home, right? So we know getting fit and regaining strength and motion doesn't just happen when we go to the gym, right? We've got to do stuff at home and in everyday life. To help us really get consistent care, get good stretching and movement and strength, and having the owners be really conscious of that, have an action plan for at home, can be really, really helpful with reaching these goals, right? Okay, let's talk about range of motion, right? So range of motion is exactly what it sounds like. It determines or reflects the range of motion that we can get for a particular joint, right? So if, your shoulder can do this versus big motion versus maybe having really limited range of motion from an injury or surgery or degeneration, arthritis, things like that. And so we do different exercises to help increase range of motion, right? We want full function, mobility, strength, all of that comes from being able to have a normal range of motion with our joints, right? And so there's 3 types of range of motion exercises. There's passive range of motion, which simply is movement to help with circulation, right? It doesn't prevent muscle atrophy, doesn't help build strength or, muscle mass, but we're basically passively moving an injured limb or an animal that's immobile, right? So an animal that may be recumbent or laying down, won't get up, we can kind of gently move their limbs just to help kind of get circulation going and get movement there so the muscle doesn't start to become injured. Then we have active assisted range of motion. And so this is something where we instigate or assist the animal to make a motion, maybe something like pinching toes to cause them to pull it back. And this is just simply to help prevent muscle atrophy, right? So we're slowing down just the breakdown of muscle from not being used. And so active assisted range of motion is guiding the animal to make a motion just to keep that muscle kind of in use, right? If you don't use it, you're gonna lose it. And then the third type of range of motion exercise that we do is called active range of motion exercise. So this is like physical exercise. It prevents atrophy of muscle, breakdown of muscle, but it also helps build strength and muscle mass, right? So we're trying to beef up muscles. We're doing hard physical activity or regular physical activity with the intent to help build strength and muscle mass, right? So 3 types of range of motion exercises. We've got passive, we've got active assisted, and then active range of motion. We also look at stretching, right? Hopefully all of you out there stretch well before you do any kind of exercise, but also stretching should be a part of daily life for most of us, right? So, we want to keep our bodies limber, keep those muscle fibers nice and stretched out. Here in the hospitals, part of physical rehabilitation, we use stretching to take tissues just past the point of range of motion, right? So if I can only move my arm kind of to here, stretching might be just a little bit past that, right? So we find that area where we can take the tissues and then we move the tissues just a little bit further past that. Usually we hold for about 15 to 30 seconds, and then we can repeat that several times with little breaks in between. Just trying to get those muscles moving around, get those tissues loosened up, break down scar tissue, and help with that. If we stretch too fast or with excessive force, we can actually injure patients. And so really important that when we do stretching, it's not just willy-nilly, it's very much from a trained hand that a person knows what they're doing, right? Then we also have massage. So these are forms of manual kind of therapy that we employ here. So the goals of massage is to reduce muscle spasms, right? Reduce swelling. We provide pain relief, relaxation for animals, as well as help release trigger points, right? So just like us, animals get knots in their muscles, they get really tense, especially, when they're restricting use from a certain body part after injury, or maybe overuse of another body part, trying to kind of save themselves from using a leg maybe. If anyone out there's ever experienced, an injury to one of your legs or your arms, maybe you're going to walk more heavily on the other leg, and, subsequently you'll find either your back kind of tightens up or your other leg will. And so this is a way for us to really help kind of smooth those out, and it feels really good. It releases endorphins for them, helps relax, and we know that lowered stress levels really help increase healing times. And so something that we provide here, sometimes we teach owners how to do gentle massage or intentional petting, we call it therapeutic petting at home, so that they can kind of help their pet, on a more regular basis. And so stretching, range of motion, massage, those are all some awesome things that we can do here. Okay, let's talk about aquatic therapy. So aquatic therapy or water therapy allows muscle strengthening with reduced impact on the joints. It helps with gait retraining, right? So after an injury, an animal may be favoring a limb a certain way, and we want to retrain them to walk properly so that they avoid re-injuring themselves. We want to help improve proprioception, right? So the consciousness of placement of limbs and body positioning. So that's something that we can help them with during aquatic therapy. We want to improve strength as well as cardiorespiratory and muscular endurance. So it's really good for athletic dogs beyond injury, just trying to help them with sports therapy and training in that way. Range of motion is also targeted with aquatic therapy, and just overall well-being, right? It's a fun thing for them. It's something they can accomplish, and we love to see it, right? So some important properties of water to understand how it helps with this therapy is One, we look at buoyancy, right? And so if you've ever been in the water and just let yourself kind of float, that's buoyancy, right? And so we tend to float in water. And so what it does is it decreases the stress on the joints. And so water depth, if we have a dog standing in water, water depth at their tarsus can actually reduce their body weight by elevating their buoyancy, right? So it reduces their body weight by about 10%, right? So they feel 10% lighter as they're exercising. Now, if we raise that water up to the stifle, actually shaves off about 15%. And then if we go all the way up to the trochanter or the hip, we can remove 60% of the body weight. So an animal feels really light, is able to move really easy, less stress on those joints as they're exercising in there. So it's a really, really awesome thing. We also look at viscosity of water, right, for strengthening. So we have frictional resistance as they're moving through the water, right? So we know moving through water is more difficult than moving through air. Anyone who's ever tried to run through maybe standing water or anything like that, you know that it's causes some friction for your body. So we add muscle strengthening by, having the viscosity of water there. We also have surface tension. So water molecules have a greater tendency to adhere to each other on the surface of water. So breaking through that surface, there's a little bit of tension there. So again, adds in for strengthening muscles, right? So we can exercise really well there, kind of get more bang for our buck, right? It's similar to kind of working out or walking with weights maybe on your ankle. Just helps add a layer of strengthening technique to that therapy. The hydrostatic pressure, right? So when we're in water, we feel a little bit of pressure against our bodies. That compression can really greatly reduce edema, which we see with injuries, right? So we have swelling, kind of puffiness, and then the water there can help compress that a little bit and actually redistribute some of that fluids. We also look at the warm temperature of the water. So in physical rehabilitation, we're going to be using warmed water for patients to be working in, just like a heated pool. And that can be therapeutic. It reduces swelling also. There's some studies that show that it improves neural pathways, right? So we can start to get better sensation feeling and restored nerve function. And so all of those are really important aspects of aquatic therapy and how they can be extremely helpful. So let's go take a look at some of these modes of therapy. Let's talk about lasers. Pew, 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 pew. Okay, so not that kind of laser, but we're talking about light amplification by stimulated emission of radiation lasers. And so those are types of lasers that emit photons, light photons that are absorbed by mitochondria. They increase ATP production, and they also require the use of a fancy eyewear to protect you and our pets. So what does all of this mean? It means that lasers bring healing. You'll hear these referred to in your clinic as low-level lasers. or therapeutic laser therapy. And so what these do is we see an increase in cell metabolism. And what that does is it reduces inflammation. And as we know, inflammation leads to discomfort, it leads to pain, decreased circulation, all of which delay healing, right? And so when we use this laser, not only do we see a decrease in inflammation, but as a part of that, we see increase in nucleic acid synthesis. So we can see new cells getting generated, cell division, fibroblast proliferation. And so we actually can help stimulate regeneration of tissues in some areas. And so it's a really useful means of non-pharmaceutical analgesia, right? So it provides pain relief without having to take any medication or apply any chemicals to the body. And so it's really helpful in that. It increases oxygen and blood flow, muscle calcium uptake, as well as increasing neurotransmitter release. So really good for injuries and just kind of degenerative issues and kind of just getting the body back into shape. And so the things that we use it for here works really well for lick granulomas. We can use it for wound setting also, self-trauma, superficial skin infections. It actually is supposed to work really well for feather picking and birds to help with inflammation and irritation due to self-trauma there. We use it a lot here at our clinic for IVDD, so intervertebral disc disease, so on the backs, and helps a lot with that area. It can even be used for otitis externa, so external ear infections. We can apply it on the outside of the ear canal to help reach internally and help relieve that area. Cystitis, it's been used, externally to help treat bladder irritation. And so there's just tons of ways that we can use this laser. And so, plus the eye protection goggles are just super, super cute that they wear. So let's go see some lasers in action. Let's talk about shockwave therapy. Sounds super freaky, but it's actually not. It's painless for the most part, and easy to apply. It's non-invasive. And basically how it works is we have a wand that applies a high velocity and high pressure sound wave to tissues. And the result is a tension and compression in the tissues that result in microcavitation bubbles within that tissue. So we kind of like if you've ever been in the water and you see something move really quickly, or maybe you move your hand really quickly and bubbles kind of form around the object. That's basically happening within the tissue. And when those little micro bubbles collapse, there's a release of energy, a release of free radicals and toxins in the tissue, and that creates an increased membrane permeability. So it can help stimulate faster healing of soft tissues and non-union fractures. So when we have a fracture of bone where it's not closely joined, this kind of therapy can help bridge that gap. So some common uses that we see in dogs is for osteoarthritis. It's really great for that. Chronic tendinopathies, where we have kind of pain, inflammation there. And like I mentioned just a moment ago, non-union fractures. So let's take a look at how our rehab team applies this modality.
Yeah, that's what that is.
So this is April, one of our rehab techs, and she's working with Pualani. And what's Pualani got going on here? The Shockwave is helping her. Hi, Pualani.
So we're a little worried about compression in Pualani's spine. We want to avoid any kind of spinal strokes, any kind of degenerative disease that happens, the mineralization between the different vertebrae. So what the Shockwave is doing is it's using sound to massage the spinal muscles here, as well as break up scar tissue. It's a wonderful pain relief modality with little to no side effects. So,
That's amazing.
yeah,
She doesn't really even seem to mind that.
she doesn't seem to mind it at all. What's
Feels
great about the
good.
Shockwave is it's almost like echolocation for pain.
Wow.
Because you don't really see them respond until you get to the part where it's really painful, and then they have a little bit of response to it. So this is a good thing to use when we're not exactly sure where the pain is localized.
Super cool. Thanks, April. Thanks, Pualani. We've learned so much so far. I hope that you have a better understanding of physical rehabilitation and how it can be applied following surgery, injury, or just plain old degeneration. But that's not all we have. There are so many other modalities that can help with healing. Next up, we're going to talk about some additional ways that we can help animals recover, and that can also be applied to other healing processes as well. We're here today with Kayla Sterling, and she's our licensed acupuncturist. And hopefully, Kayla, would you tell us a little bit about acupuncture and why you got into that?
Sure. I got into acupuncture, 30 years ago. I wanted to study something that was ancient, an old medicine, something that we could do without big machines and huge technology and surgeries and cutting open and invasive and chemicals. And, there were many options, and I picked Chinese medicine because the act actually of holding a needle and learning how to insert the needle, it involves not only an understanding of the body's anatomy precisely. We need to understand veins and tendons and bones and organs, but it's also beautiful. It's an art form, and I love the feeling of holding the needle and finding the right place and putting that needle in and actually feeling the energy. It's like going fishing. You relax, you breathe, you're holding onto the needle, and actually when it's inserted properly, you actually feel the energy pull the needle, just like there'd be like a little minnow, at the end of a fishing line. And I have to admit, that connection of my energy and the energy of the animal that I'm treating or the human that I'm treating felt and still feels to this day very profound to me. And also, I love the study of herbs and knowing that there could be something that one could take internally that again wasn't a chemical, that was, a natural substance. And that's not to say that all natural substances are good for you. We know, for example, there are poisonous mushrooms. So I'm not saying, that everything natural is necessarily good, but understanding what is natural and then what is healthy out of the natural, that also really appealed to me.
Wow, that's amazing. That's amazing. And 30 years.
Yes.
Wow, I bet you've seen so much. What are some types of cases that you see currently for the acupuncture helps with?
Well, my background has been in hospice. So my, I would say, specialty or my love is either caring for geriatric patients or caring also for, with humans, I did a lot of psychiatry. And with dogs and cats, anxiety can be a large part of the disease process. So understanding, how to relax an animal prior to doing anything, is very beneficial. And, here at HVC, I treat so many internal medical disorders, cancers, Cushing's disease, kidney disease, kidney failure, asthmas, colds, coughs, allergies, skin rashes, digestive disorders, diarrhea, constipation, and of course what people think of usually when they think of acupuncture, which would also entail pain management and pain from a neck, a shoulder, an elbow, a back. But there are also very interesting disorders inside the head. Seizures I find really fascinating to treat. So I think, like I said, internal medicine is really, to be honest, what thrills me the most.
Wow. Now, I've helped you in here with some of your cases, and sometimes we almost meditate with the animals when we're working with them, and I find it's got to be pretty relaxing for them, right?
Well, I think, again, it can be relaxing depending on the practitioner. I practice the old-fashioned approach, which is to put the needles in and then to have the animals relax as deeply as possible. So, that's also learned on my part. So that, not be petting the animal and exciting the animal and chatting with the animal and feeding with the animal, the opposite. Whereby I put, the needles in, and if I do have assistance, to ask, that vet tech to please breathe slowly and deeply, and let's not chat. And, I don't know, I want to say at least 90 out of 100 times, at least 90% of the time, and maybe more, the animal does learn to relax with the needles in. And, relaxation is so wonderful, not just from the physical aspect where the muscles relax, the tendons relax, but that, breathing in itself and being quiet is an important part of the healing process.
Yes, and I think that, that's what makes integrative medicine so beautiful, is that we can take, an ancient energetic based, healing process, and meld it with science. The needle's actually stimulating neural pathways and connecting those nerve sensations and function and flow. And it's just such a beautiful thing.
It used to be a huge mystery, why the NIH first approved this needle here, pericardium 6, why would inserting a needle here, help with seasickness or nausea? And we can actually, track what's happening in the body and in the brain. But what they have come to find out so many years later is that it's actually not a neurological response as much as it is an energetic pathway of the myofascial tissue.
Wow.
That lies underneath the skin. And I would assume someday they're going to say that that's the highest intelligence of the body.
Wow.
And this is why probably so many people would say, wow, I feel that in my skin, and there's an intelligence. And I think, I think science is proving that in fact is really the miracle of acupuncture, that there is this collagen connective tissue under the skin. And so when we're doing the acupuncture, we're not actually fishing for nerves. What we're actually doing is, as a matter of fact, it would hurt to insert into a nerve, just like it would insert going into a vein or an artery. That's not the point. But it's the myofascial tissue that lines the entire skin. It's like a network of kind of like lace, but microscopic lace. And that is what actually transports the energy. It's interesting, isn't it?
Wow, so fascinating, so interesting.
Yes.
Well, thank you so much for sharing your knowledge and expertise with us, and it's been a pleasure.
I loved sharing everything about Chinese medicine, and also the animals I treat here at Holistic Veterinary Care. It's the best job I've had in my life.
Oh,
It's true.
hi, we're here with Dr. Lisa, our chiropractor here at Holistic Veterinary Care. Dr. Lisa, thanks for spending some time with us today. Do you want to tell us a little bit about how you got into this type of work?
Yeah, totally. I've been a chiropractor for the last 20 years, and about 13 years ago, I noticed my pet was having some issues, and I was like, oh, let me look into animal chiropractic. So I took Dr. Richter, along with me to the chiropractic school in Kansas, and we did a 5-month-long program and found out so many different things that are different in animals that are in people, but yet some similar, which was really amazing to add to my practice.
That's so awesome. Will you tell us a little bit about, for our listeners that don't know much about chiropractic care, you want to share with us a little bit about how that works in the body?
Sure. Chiropractic care is basically working on the nervous system that allows the body to heal. So working on the organ, the muscles, and the bones. Most people think a chiropractor just works on the spine, which we do, but we also work on the muscles around the spine, because there are a lot more muscles that hold the spine together. And we work on the organ gland function that works with the muscles and the spine itself.
Do you think you could share with us some examples of animals' conditions that might be helped by this kind of care?
Of course. So some of the typical conditions most people think are arthritis, because we're working on the joints in the spine. But we do work on thyroid issues. We work on intestinal issues from head to toe. Anything that's going on with your animal, chiropractic can be beneficial, along with our other types of holistic medicines. I do a lot of herbals and a lot of supplementation that actually help the healing process in the body, so the body heals faster. And so those are some type of examples that would be a reason why someone would bring their animal into me.
Wow, that's so awesome. Well, we really appreciate your expertise, and so do the animals.
Thank you so much. Have a great day.
Hey, Dr. Gary, can you tell us a little bit more about hyperbaric oxygen therapy and this contraption behind you there?
Sure, happy to. So this is a hyperbaric oxygen chamber. What hyperbaric oxygen is it's a chamber that pressurizes with 100% oxygen. So for example, if we were going to treat Maya here, we put her in the chamber, close it, and then fill the chamber with oxygen at pressure. Usually 1 or 2 atmospheres above normal standard atmospheric pressure. What that does is when the animal or the person is in the chamber and they're breathing all of that oxygen at pressure, it is driving oxygen into their bloodstream at levels far, far greater than would ever be possible in any other way. So for example, as you know, under normal physiologic circumstances, pretty much all of the oxygen in our bloodstream is carried by hemoglobin, is carried by our red blood cells. When we use hyperbaric oxygen, oxygen is in such a high concentration and pressure that it is dissolved into the plasma. And what happens is that oxygen will then diffuse throughout the body, throughout tissues, organs, the central nervous system, what have you. Now, the rate limiting step to healing for most problems, injuries, illness, what have you, is a lack of oxygen in the tissue. So whether or not there's an injury or there's a surgery or swelling, edema, what have you, there's less oxygen in those tissues, and therefore it takes the tissues much longer to heal. By forcing oxygen into those areas in places where even there's circulatory compromise, we're able to speed that healing process along. So brain injuries, spinal injuries, non-healing wounds, non-healing fractures, acute inflammation, things like pancreatitis or hepatic inflammation. We've treated a number of black widow spider bites with great success. So there's a lot of things that hyperbaric oxygen could do, and we find that it is a very good complementary therapy that we use along with physical rehabilitation in certain cases to really move these guys forward and get them to heal that much quicker.
Radical. So let's take a look at this in action. We have a little dog getting placed into the chamber here. This is Lilu. We have a camera to monitor her. We mist them with water to help reduce static electricity. They could just kind of curl up and get comfy in there as we do the treatment. We seal the chamber to create the pressure. And then we go ahead and begin to deliver oxygen and monitor the rates and pressures as it increases. and leave them in there for about an hour after we reach pressure. So veterinary physical rehabilitation may be something that appeals to you, but you may be wondering, where do I fit in with all of this? Like, how could this impact my career? And so there's a few different options for people to work in this field. And so first, starting at the top, we have something called a CCRT. So that's a certified canine rehabilitative therapist, and that is for veterinarians and human physical therapists that want to switch fields and get into what we do. The other types of certifications you can get is a CCRVN. So this is a certified canine rehabilitation veterinary nurse. This is something that's for RVTs. So once you become licensed, you can then continue your education in the area of physical rehabilitation and get certified there. There are certifications for vet assistants also. So CCRA is Certified Canine Rehab Assistant. That's something that you can do. There are quite a few different platforms out there to get certified in. You can search in your area or do some research and see which program seems most applicable to you. And then there's also a position of a rehab assistant. So you can get hired in a clinic that offers physical rehabilitation and learn kind of on the job how to support the rehab technicians, assist with therapies, and be generally involved in this kind of care. All of these positions are extremely rewarding, especially if you love working closely with canine patients, feline patients. We've had guinea pigs, all kinds of animals. So you work closely with them and your practitioner to meet goals and ultimately really make a difference in mobility and pain management. We've shared so much information with you today about how to further the practice of veterinary rehabilitation. As obviously necessary as this type of care seems, it's still relatively new and blossoming in our field. And so knowledge is power, and we encourage you to share that with others, ask questions, bring it up in your practice. Thank you for having an open mind today and kind of learning more about these different types of care. And we would ask you to just take it with you, share it with a friend, and as always, stay learning.